My name is Jennifer Snow, and I'm a licensed practicing counselor for the Cognitive Behavior Institute.
My name is Ann Mikulich, and I'm a licensed practicing counselor. I am also certified in cognitive behavioral therapy from the Cleveland Center for Cognitive Behavioral Therapy, and I practice at the Cognitive Behavior Institute in Cranberry Township, Pennsylvania. Today we are going to talk about drug addiction.
Addiction is something that has touched so many people's lives in today's society. You hear about it every time you turn on the news, every time you open a newspaper, and there's families struggling with many different aspects of both addiction and substance abuse. There's a wide variety of patients that we see that come in struggling from beginning with experimentation the whole way to a full-fledged addiction that's been set in place for many, many years. Drug and alcohol abuse is basically something where someone may be having consequences for experimenting with drugs and alcohol, but they have the ability to stop on their own. Dependence is when an individual is suffering consequences from their use or their addiction, but they are unable to stop on their own, and they can only stop with the assistance of a professional.
So the way that I describe it to patients, how cognitive behavioral therapy is used in treating addiction, is that your brain, imagine your brain to be this amazing meadow, and the cognitive pattern that you've established through addiction in this meadow is clean cut, it's comfortable, you know how to get there, you know the path, everything has been cleared for you, there's nothing in your way, and you're going down that path. But with cognitive behavioral therapy with addiction, it's redirecting that cognitive pattern to another path. And in this meadow of your brain, the path is overgrown, it's not clean cut, and it's very difficult and uncomfortable. You have to really work to change that cognitive pattern. And a lot of times the hiccups come from folks really gravitating toward that clean cut because that's what they know and that's what's comfortable. But with cognitive behavioral therapy and at the Cognitive Behavior Institute, what we do is we redirect that cognitive pattern so that they can establish a new path with new motives and new incentives that navigate away from that addiction and taking them down a better road.
Anything you want to add on to, Jen?
I'll just say, in addition to that, to summarize that, it's also saying that, in addiction and substance abuse, you've trained your brain to be in a self-destructive pattern for a long period of time, and most people are unaware or unsure of how to change that into a more functional daily pattern. Some of the things that we do here to help a patient treat their addiction is become aware of what the purpose is of their drug use, what function the drug use has in their life, and find a newer, healthier way to handle that same issue. And we know that if you do something over and over again, if you learn a healthier way and you repeat that over and over again, you actually train your brain to function in a healthier way. So we offer a range of teaching coping strategies to deal with emotions and everyday stressors, healthy activities to engage in, and taking a look at the views they have on themselves and of life and the world around them, and finding the thoughts that are self-destructive and replacing them with something healthier.
And for more information regarding addiction or drug abuse, please contact the Cognitive Behavior Institute at 724-609-5002 or visit us on our website at papsychotherapy.org. Thank you.